Hey everyone, welcome back to another Intellect nursing video. Today we're going to go over cystic fibrosis. So we're going to go over all the details you'll need to know and understand for the NCLEX and nursing exams. So that includes your pathophysiology, the risk factors, the complications, signs and symptoms, and management. So let's get right into it. As always, make sure you guys head to the pathophysiology concept maps if you want to follow along and maybe write some extra notes that we're about to go over in this video lecture. So cystic fibrosis, let's first start out with what is it? So to put it simple, cystic fibrosis is a genetic disorder that causes thick mucus, creating infection and obstruction. Mainly the respiratory system, the gastrointestinal system, and the reproductive systems. It mainly is related to a CFTR gene that causes an abnormal ability to transport chloride throughout the body. In result, there is an increased reabsorption of sodium and water in the epithelial cells, which creates this viscous or thick mucus in the body. And once again, this likely collects in the lungs, the pancreas, the gastrointestinal system, or reproductive organs. And because of that thick mucus, it causes obstructions in those pathways, and the thick mucus is also a source of infection because bacteria loves to grow in dark, warm, and stagnant environments. So who is at risk for having cystic fibrosis? So this is a genetic disorder and it is autosomal recessive, which basically means that both parents have to have the CFTR gene but not have actual cystic fibrosis. So typically these families do have a history of cystic fibrosis. So studies have shown this is more affecting the Caucasian ethnicity, and it's equally with male and female. Now let's go over signs and symptoms. Now the NCLEX and the nursing exams heavily focus on your ability to identify cystic fibrosis, and with that apply the complications that you're likely going to see if a patient is admitted into the hospital. And all of it really stems down to your understanding of the pathophysiology. So once again, to put it really simple, cystic fibrosis is a genetic disorder that is related to thick mucus that obstructs and infects the body. And once again, it heavily affects the lungs, the pancreas, the gastrointestinal system, and the reproductive organs. So your telltale hallmark sign and symptom here is of course going to heavily affect the pulmonary system. It's the most obvious with these patients, of course. So you're going to have thick mucus in the lungs. So with that, it's going to cause frequent coughing and hypoxia. Because of that thick mucus that's almost very difficult and impossible for some patients to get rid of through just simple coughing. And because that mucus is so thick and difficult to remove from the lungs, it's usually stagnant, which is a good environment for bacteria to grow. So these patients commonly have lung infections, so pneumonia is not something that is uncommon for a cystic fibrosis patient, and that's typically why these patients get admitted into the hospital. So this is a chronic condition, so they could have frequent lung infections, get admitted quite often because of this inability to remove secretions. So of course, you're going to think of it like COPD, where it's a chronic lung condition. It's kind of the same thing here, where these patients are going to have things such as clubbing and potentially even barrel chest. Now on to the pancreas, which is the second most affected organ from cystic fibrosis. Now the pancreas is responsible for endocrine and exocrine functions. So endocrine meaning your insulin release to help absorb nutrients in the bloodstream, and your exocrine function releasing pancreatic enzymes into the gastrointestinal system. Now one of those signs and symptoms that you may see with cystic fibrosis patients is bulky, greasy stool. And that is because this mucus could quite literally be blocking the ducts that lead to the gastrointestinal system that typically have the pancreatic enzymes go through. And one of those pancreatic enzymes is called lipase. And lipase is responsible for breaking down fats in our gastrointestinal system. Without it, you're going to have a lot of excess fat still left in that gastrointestinal system, which usually exits with the stool itself. So not only are you going to have bulky, greasy stools, you're going to have malabsorption related to this as well. So something that the NCLEX and the nursing exams like to test your knowledge on is, how does the bulky, greasy stool present? So of course, the word's describing it, but also bulky, greasy stool floats. So if you have a patient who is expressing that my stool is floating, it's bulky, it's greasy, then likely that is because there is no breakdown of fats happening in the gastrointestinal system. Now heading over to the endocrine functions, because insulin is deficient in this case, you could have things such as weight loss. Insulin is responsible to transport glucose into the cells of our body, and without that, we're having an inability to absorb and gain weight at that point. So that glucose just sits in our bloodstream and can cause hyperglycemia and weight loss. So make sure you write those down. Lastly, not something you would typically assess yourself, is these patients usually have salty skin. And that is because, once again, the reabsorption of sodium and water in the epithelial cells and the inability to transport chloride across the body. Now let's get into the complications of a cystic fibrosis patient. Once again, the most common complication you'll see, or case that you'll see with these patients, is a patient coming into the hospital because they have pneumonia, so a lung infection, because of their inability to get rid of that thick mucus in their airways. So these patients can have recurrent lung infections, and because of that, with each one of these infections, it could cause permanent damage to their lung tissues. So eventually, these patients do have a shortened lifespan, and it causes chronic respiratory failure. Other complications include pancreatic insufficiency, which could lead to diabetes because of that decrease of insulin being released into the bloodstream to convert that glucose into glycogen. You're going to have malnutrition because of the inability of the pancreatic enzymes to reach the digestive system. These patients usually have issues with infertility because of that thick mucus preventing fertilization. And you could have constipation and ileus because, once again, those pancreatic enzymes are also responsible for peristalsis and stimulating the bowels. If there's no stimulation going on, it can end up causing an ileus. Now, what are the common diagnostics that we use to confirm cystic fibrosis? Now, this is most commonly found with newborns. So within the first 2 months, we're likely going to know if a patient has cystic fibrosis. Through modern technologies, we can find out even before birth that this patient has the genes that are related to the cystic fibrosis. And that is usually checking directly for that CFTR gene mutation. So if it's positive, that is your hallmark diagnostic. But for testing purposes, you're also going to want to know about the chloride sweat test. So if that chloride sweat test is positive, then that is also another sign, but is not as accurate as the actual gene mutation test itself. Now let's go over the management of these patients. So these patients are chronic disease patients. So they're going to constantly be needing treatment and medications to prevent infection. That is the biggest goal for these kinds of patients, is to prevent the recurrent lung infections and preventing them from being admitted into the hospital. So the goal is to get the secretions out of the lungs because that is the biggest risk for admission into the hospital. So we're going to give them bronchodilators, mucolytics to decrease the thickness of the mucus, and typically prophylactic antibiotics to prevent infection. And lastly, we'll do something called chest physiotherapy. A lot of times they even do this at home to, once again, prevent infection, get the mucus out, and they do this on a daily basis, sometimes twice a day. And of course, they would do this in the hospital itself if they are admitted for a pneumonia. Now, that is all focused on preventing infection in the lungs. Now, for the pancreas, we talked about how there's exocrine and endocrine issues here. So we're going to be supplementing with fat-soluble vitamins. That includes your vitamins A, D, E, and K. And the reason for that, once again, is because our inability a lot of the times to excrete lipase into the digestive tract. So this will help break down those fats in the digestive tract. Now, along with that, you're going to be supplementing pancreatic enzymes. So once again, since there is a decreased ability to excrete those pancreatic enzymes ourselves with the pancreas, we're going to supplement with the pancreatic enzymes. Now, the pancreatic enzymes usually include all three, which is your lipase, amylase, and protease. Your lipase being your fats, your protease being your protein, and your amylase being your carbohydrates. Another type of medication they may give these kinds of patients, and it does depend on the exact gene mutation itself, is a CFTR modulator. This helps manage the underlying issue with the chloride pathways, and it can actually act as a chloride pathway by using these medications. So since these patients are at risk for malabsorption, we're going to encourage a high calorie, high protein, and high fat diet. Now, also being careful watching the carbohydrates because they're at risk for diabetes because of that decreased insulin production or release into the bloodstream. Now, as the nurse taking care of a patient, whether you're in the hospital or in the outpatient clinic, the nurse is always wanting to look out for respiratory infections because that is the main complication and likelihood that there's an exacerbation going on. Also, the NCLEX and the nursing exams are likely going to test you on this concept, so make sure you write it down. Chest physiotherapy is an important part of the management plan, but the nurse must know when it is the right time to do chest physiotherapy with these patients. So you're likely going to get a question about a patient who's in the hospital or acute exacerbation of cystic fibrosis, they have pneumonia. They're ordered to do chest physiotherapy twice a day, every 12 hours. and it's going to ask you when it should be appropriate to do it. Basically, you just need to know that you should not be doing chest physiotherapy right before or right after meals. And that is because it could cause vomiting and then cause aspiration with these patients. Now, the time that is suggested could depend on your textbook, so make sure you look for that if there is a time suggested on how long you should wait before or after. But that is a very common concept that they'll test you on in the NCLEX and the nursing exam, so make sure you write it down. Another thing you'll have to consider with chest physiotherapy is postural drainage. So understanding what positions promote the drainage of that thick mucus is another thing that you'll want to write down. So we will be providing those positions here as an illustration for you to write down along with the names of those positions. All right, guys, that ends this video with cystic fibrosis. I hope this video was helpful for you. If you guys want to see more videos like this, make sure you head over to our YouTube or on the membership. Thank you all for watching, and we'll see you in the next one.